Well, good evening, everybody, and we appreciate all of you tuning in, those who have been following our conversation on LinkedIn throughout the season, and those who are joining for the very first time for our conversation. We're going to begin with just brief introductions and maybe talk a little bit about each one of us, the character that most resonated with us during the show. For those that are tuning in, if you have any questions, discussion topics you'd like us to hit, please go ahead and submit your questions through the Slido. You should be able to access that on the webinar. Anyway, my name is Ken Heinrich. I am Chief Medical Officer for Emergency Medicine for SCP Health. I did my training in Chicago, and that's where I continue to make my home. And character for me that actually resonated the most was Nurse Dana. I think most of us who have been in emergency medicine have worked with a charge nurse or another really strong personality like that, who just cared a lot, was really passionate, knew the ER, and could make or break a shift for each one of us. And I learned very early in my intern year that I had to embrace those people, show them genuine respect. And if I did, they'd make my life better in the ER. And if I didn't, then that was my own fault and I was going to suffer. I will then turn it over to Dr. Nichols. Why don't you introduce yourself?
Steve Nichols, my role at the company right now is Chief Clinical Innovation Officer. I practiced in mostly rural Texas, emergency medicine, and for me, it's an easy choice. It's Abbott. I've always loved nights. I loved nights before I even got into emergency medicine. I take a few risks. I still snowboard out in the side country, and I've been deep in the trees and deep in the powder a couple times, as well as a few other things. So that one's easy for me.
All right, Dawson.
Good evening. So Brian Dawson, emergency medicine training in North Carolina, East Carolina University, and have practiced in a variety of practice environments. Currently practicing at an emergency department in Eastern Tennessee. Actually have a shift on Saturday. Looking forward to that. And for me, like I couldn't, much like reading different books, I found that I identified with different characters at different moments in the show. And so whether it was the tough case and spending some time in the ambulance bay just processing, or you got the diagnosis right and you feel great, and then the very next case you totally miss it and you feel awful and you don't understand how you missed it. Like different characters resonated at different times. Even sometimes the stress where you see the characters displacing on their teammates or their family, and you're like, oh, that's just not right. But you're like, I've been there, I've done that, and felt bad about it, had to go like clean that up afterwards. So it wasn't a specific character so much as I identified with a lot of the situations and characters throughout the season.
Mm-hmm. Yes, I'm Bentley Tate. I served as an emergency room physician out in Colorado, where I'm talking to you from, in rural Colorado out in the Eastern Plains. Denver's home for me, but did that for 29 years. And I've had the privilege of serving as SCP Health's Chief Wellness Officer, trying to be a doctor to doctors to help my many colleagues stay a little bit healthier and a little better outlook on medicine. The character I think I most enjoyed was, in terms of resonated with, maybe aspired to be like her in the rearview mirror, would be Dr. Al-Hashimi. I appreciated just that she was consistently calm despite the chaos around her. I realized how helpful that was when I did that. I hope I did that more often than not. I appreciated how she was observant of what was going on around her with her colleagues. Good behavior and bad behavior, but she didn't just follow being observant, but she just seemed to me patient and wise to find a strategic opportunity to bring things up when she needed to as a leader in that emergency department. Maybe what I most appreciated was she was someone in her character that I hope I was as well during my 29 years. And that was someone who smiled more often than had a cynical look or a frown on their face.
Excellent. All right, so we have all spent all season somewhat dissecting and sharing our thoughts about the entire season and the show. So let's just spend a few minutes, each one of us, talking about what we thought the show really got right from our perspective, where the show might have missed a little bit, and then what made us roll our eyes at some point. And Brian, since you kicked off this journey with us on the first episode, why don't you begin?
Yeah, thanks, Ken. So for me, like what I really enjoyed, I had not watched season one. And so I came into season two not knowing what to expect. And what I found was just the humanity, like the fact that the patients, the clinicians, the environment, like it wasn't just a case. Like they did a very good job of developing the characters and the stories of both the patients and the staff. And what's going on in their life. Like they're more than just that particular case. Like there's a lot more below the surface of that patient encounter. Much like when we work a shift and we walk in the room and they say, I'm here for back pain. And then you find out that actually one of their loved ones, their child, passed away last week. And so they're there for a physical ailment, and they're there for an element that cuts deep to the core of their humanity and their soul, if you will. And so I thought they got that right. I really enjoyed seeing that. And then the other thing they got right about emergency medicine is you can go from a very impactful case like that one I just mentioned, and then you step in the next room and it's a patient that just needs a work note because the fast food restaurant they're working at required them to show up in the ER. And you move to that. And then for, I roll, like, I guess what I would say, just most of the cases I'm like, yeah, I've seen that before. But they did pack a lot of rare cases that all of us may have seen a few times in our career into a single shift, for the sake of television, I'm sure. And we see those and did a great job of depicting them, but we don't see all of those zebra cases, ER doctors would refer to them, in a single shift. So, but we care. Like they got that right. The nurses, the doctors, everyone who shows up in the emergency department to work a shift, they genuinely care for those patients.
Yeah, I agree.
Definitely.
How about you?
Yeah, I just following up on some things that Brian said. I think there were some things that they really hit the nail on the head. That one of my convictions, just dealing with looking after physicians and their health, nurse practitioners and PAs as well, is that whether you end up at a place of thriving and happiness or despair and burnout, they both have something very much in common, that you tend to get to either one of those places by just the accumulation of shift after shift, of day after day in life. The show's about one shift, taking 15 episodes or so to show us, but I just had a sense that the shifts in the rearview mirror were very much the same for them, and the ones ahead were going to be very much the same. And so it shows just that Dr. Robbie and even the young physicians were on a path of the accumulation of however they dealt with and the cards they were dealt. I think they nailed in terms of the pace that was there. One of the aspects that I think is so true in emergency medicine is there's not the time to pause and reflect and process, just the relentless things you're exposed to, whether it's just tough illnesses, long-term problems, death. Little of what I saw on the show showed people having the time, energy, or the capacity to process things in the midst of the workday, however hard they were. And I think that part was kind of accurate. Maybe the eye roll for me, again, I've got this wellness, this concern for physicians and them, lasting in medicine, that I just felt like was just this sense that was encouraged, maybe somehow portrayed, that when you walk through the ambulance doors, you're coming from home, walking into the ER to begin the shift, that you just can somehow magically leave all that's going on in your life and show up at work. Or the other, you can leave the hospital and leave all the good and the bad you've just experienced for 10, 12 longer hours and head through those same doors and just leave it all behind. That gives me an eye roll, because it's just not consistent with how human beings live life.
Yeah, I think that's right. I think it's tough to put up that wall We were all taught, I think, in residency before we're walking into a code, the first pulse that we have to check is our own. And so it's important to create that separation. But as you said, we're still bringing in some of the pressure, some of the good and the bad from our own lives. And for me, I would say the show got a lot right. I want to be clear. But one of the things that really I thought they did a great job of portraying was just the pressure of what it feels like to work in the fishbowl. And for those that don't know, who aren't in emergency medicine, that's what we all say. Everybody sees what's happening in the department. Everybody's coming into the department. Medical staff are walking down. We see what's happening with each other. It really does feel like we're practicing in a fishbowl. And there's a lot of pressure, a lot of stress that goes along with that. And I thought the show just did a great job of actually demonstrating that feeling and really the impact that it has on everybody who's in that ER. One area that I thought maybe they could have done better, at least I didn't love, was, I would say, the level of autonomy that we saw in the medical students, certainly, and even interns. I think that's evolved as we all have gone through our careers, but in training today, I think there's more supervision. There were a lot of bad outcomes, and they needed to show those bad outcomes. But I actually think, I hope it didn't leave the public with an impression that when they go into a teaching hospital, they're going to have untrained medical students who are going to be dictating a lot of the care. The one time that I sort of rolled my eyes a bit, and we've all talked about this, was when Langdon had to do the closed blind cervical reduction. And what I mean by blind, for those that don't know, is he did it without x-ray or fluoroscopy or anything. We all once in a while have to cowboy up, so to speak, but we weigh the risks and balances before we do something like that.
Yeah, I think that cowboy up thing, that is a risk and balance thing. It reminded me, when we've talked about it in other times, of an episode where I'd gone down to work in a hospital, was going to get hit by a hurricane. And so I do like risk. And while we were there, we were still running on generators. We finally got the other generator up, and we were trying to get somebody to get a CAT scan. It wasn't my patient. The patient had a little tiny IV, a 22 gauge. The other doctor came to me and said, man, I got to try and find this IV. She was hard to get the 22 in. And I go, you know what you could do? You could just take a triple lumen, take out the guide wire, slide the guide wire in, pull off the 22, slip an 18 in, and I bet it'll work. And he goes, oh, and he leaves. And he comes back, I don't know, 20 or 30 minutes later, he goes, hey man, that worked. That was great. How many times have you done that? And I go, oh, I've never done it. I've never even seen it done. I've never even read about it. It just seemed like it might work. And he was like, huh? I go, did it work? He goes, yeah, it worked great. I go, you can write it up if you want. Probably can get it published. I don't know, trick of the trade, whatever you want to do, man. But I'm glad it worked because we still got a lot of people to see. So I think, there was low risk and everything, but some of it is we like to cowboy. We are used to taking care of whatever we can with whatever we have. So that part, granted, it was exaggerated, just like a lot of the stuff. I mean, TV and movies these days, it's always kind of like Sharknado. How much stuff can you cram in the time that you're watching it? The thing that surprised me, but I also thought it really nailed it, was the end where they were singing karaoke. Okay, two people you wouldn't have thought would get together, but they've gone through a very bad day in a lot of ways. And hey, let's just go get some of this out of our system. Let's get some different energy in and release some of the negative energy. And that really did hit a place for me. The other thing that was an eye roll was just also the amount of incredible technology, right? Not every place has all that technology, particularly in community hospitals. A lot of the things you saw, you don't have the availability. So that was it, but not a surprise, I guess.
Yeah, I do think you're right, though. There is unevenness in medicine. There are differences between hospitals. There are regional differences still in healthcare. Certainly in emergency medicine, we never know what's going to walk through or be driven through our front door during a shift. So I think they demonstrated that. to your point, maybe they had more technology, but we got the sense that they had it because they were an academic institution. So I guess what else did the show surface for all of you? Again, Brian, why don't you kick us off?
I guess I would resonate with what you were saying. Like the emergency department, all of us who went into this and trained many years ago, like we knew going in that this is the front door of the hospital. This is where everyone comes for anything from the hangnail to the heart attack, the car crash, whatever it is. We're there to see them in that moment and take care of them. What I think the show did do a good job of demonstrating and maybe kind of compressing for us in the one shift is, I think emergency medicine today versus 10 or 20 years ago, like it keeps getting more complex. The volume and complexity keep going up. The societal expectations of, we don't know what to do with that, so why don't we just have the ER do that? They should ask that question. They should enroll the patient in this. They should take care of that problem. And so stuff that used to find itself in other places in the society safety net are now in the emergency department. And I think the show did a good job of surfacing that throughout the season for us. And it didn't feel invented. Like we've all on this, probably many of those watching or participating tonight, we've experienced workplace violence. We either have experienced it personally or we've seen it occur to our partners at work or our teammates while they're working. We certainly have seen the unhoused patients, the social crisis, the opioid epidemic, drug addiction. Like we've all taken care of that. I think the show got that right for us as well. And certainly while it's no place that our patients would want to be, we're always open 24/7, and we always have our lights on, and we're always there ready to welcome them and take care of them. And I think that's something that we should all be proud of. And I think the show did a great job of demonstrating that to society.
Yeah, Brian, I would add to that. I think the show did a pretty good job of showing that we get asked to handle a lot of hard things, things we don't feel ready to handle. Most, I think, people would think outside of medicine, of course, you're going to not have seen every disease, or, maybe you haven't done a procedure for a while. And true, that's part of hard, is diagnosing something that's infrequent or you've never seen before. But, part of what's hard is a lot of the other stuff that I think many of us would say, I don't know if I got mentored or really shown how to do that. I'm thinking of things like telling people really bad news. That never gets easy. I don't care how long your career goes. Dealing with problems, dealing with someone who has problems that really their problem list is a morass of decades long of social and physical and psychological problems. Some of it, maybe their issues, bad decisions over years, neglecting their health, but a lot of it just being dealt, some tough cards in life and things that were outside of their control. I mean, I even after all the years I did it, I never felt like I was just really good at trying to deal with unfixable problems quickly. That just never gets easy. And how you deal with that when the next patient is waiting and has been waiting for a while. One little antidote would be, a lot of times in the emergency room, you get asked by law enforcement to sign a serious bodily injury form. And sometimes even nicely, hey doc, can you sign this so you can get on with the other patients? I know you're behind. And I think it took me years to even realize how significant me signing that basically legal form or not signing it meant in a court of law. And I guess as I look back, I never took it unseriously. I wouldn't want anybody thinking I didn't take it seriously, but I have to say, it just felt like I was being asked to do that with about the same amount of bandwidth of time and energy that I would respond when we were ordering DoorDash and I was asked to add some fries to my order. It just is, it's just tough. It surfaced just the fact that our wellness and aspects of handling the tough things, sometimes we can feel pretty lacking in that, despite the years of training we get.
Yeah, I think that's a really good point. The fact that there are going to be some things that are really tough for us and others that are easier because we've seen a bunch. And during our training, that we're not going to see everything. I actually remember during one of my interviews for residency, one of the interviewees, sorry, one of the interviewers, one of the ER docs asked me, "What are you looking to get out of residency?" And I made the naive statement, "Well, I want to see everything I need to see so that I'm comfortable when I get out as an attending." And you guys are all laughing because we all know. But he said, "Well, that's impossible. You
Yeah.
will never see everything
No.
in your residency, but hopefully by the time you're done here, you'll feel comfortable handling whatever comes in." And that's what it's all about. It's learning to feel comfortable with it. And certainly I was blessed actually because my residency program, we had 3 different ERs, very, very different practice environments. So I got exposed to a lot. Bentley, I had law enforcement in all the time because a couple of them were inner city. So I probably got a little bit more used to that. That goes back to some of the unevenness, I guess, of distribution. But again, I think we all see enough, hopefully, during our training that we can handle what comes through our door.
Yeah, yeah, you never see it all. I practiced in Southern California for about 10 years before I moved to rural Texas. And it was a different set of stuff, but some of the things were the same, like delivering bad news and things like that. The unevenness can sometimes be the other way. We at one point had to accept kidney stones from larger cities to ours because we were the only ones that had a urologist. At another time, I had a patient in a trauma center who came to us. He had a trauma. We had just gotten a new 64 slice CT scanner. I CT'd his neck. Everything seemed fine. My general surgeon wanted me to call the trauma team up in Dallas. So I call him. He's looking at the scan and he goes, "So we need to get vascular clearance?" I go, "That's what they want." He goes, "That looks like it's a brand new CT scanner." I go, "It is. We got it 2 weeks ago." He goes, "Can you do a vascular reconstruction?" And I go, "Me? No, I can't. But the guy here next to me, the tech, I hope he knows how." And he goes, "Yeah, I learned last week." So literally, it's like 2 minutes. And they put up a nice 3D representation of the vasculature, could spin it around. It looked like special effects to me. It was incredible. And the vascular guy over in Dallas goes, "That's it. We're done. You don't need to send him here." I don't even have that capability here. You'll actually be sending him to, like, we're supposed to get ours, but it's not in yet. So keep the patient. You're done. And that was incredible. And the surgeon was like, "Really?" I'm like, "Look, he gave me his name, his cell phone." He says, "Call him if there's any problem." So it isn't spread evenly everywhere. I think the best thing they did, again, they compressed it all together, but they showed what a mess things are in US healthcare right now. I mean, all the stuff that's come together. This isn't the system we built by a plan or anything. It's just grown together. And unfortunately, it's reached the stage where enough is enough. I think many, many people feel that way. Not just the clinicians, but patients, people. It's just something that technology can't fix. We have to figure out something better because it's not going to get better on its own.
Yeah.
I think that's what they hit hardest for me.
Yeah, I could not agree more. We know about burnout. We all see it, unfortunately, throughout our careers and colleagues and friends, sometimes in ourselves. And I don't even like to use the word burnout. I really do think it's moral injury. It's the healthcare system. It's not any individual's fault. It's this big, complex system that does it. But it's tough. So on that point, I guess we're done with the Pitt. It was a TV show, and yet we all know that hundreds of thousands of healthcare workers are showing up to work and will continue to show up to work in ERs across the country. So what does it take for all of our colleagues and for us? Brian, you're going in on Saturday. What does it take to keep showing up despite that system?
I think for me at least, like, I guess we could say it could be hard to keep your humanity with the chaos that the healthcare system's become and that an ER shift has become. I think we have to kind of hold all of that and not drown in it. And for me, it's thinking about that one patient or that one encounter that I'm looking for on each shift. Sometimes it's more than one, but I kind of approach the shift like I'm certain that there's somebody here today that I'm meant to see and that I can have add value to their experience, to their life. And sometimes I know who that is after the shift. Sometimes I don't. I certainly pray about that and think about that going into the shift. Like I have a parking lot ritual where I stop and just sort of take a moment. Like Bentley said, you can't leave your whole life behind you. And I think I wrote about this on one of my posts. Like I'm carrying my humanity and myself into the emergency department. That makes me better than if I just shuck it all off and compress it down and don't experience my own humanity. But stopping for a moment, pausing, thinking about what I'm about to enter, and trying to be present for those patients and say a little prayer for who's that one that I'm here to see today. And it's a really cool gig that we get to do. Like I still find joy in going to the emergency department, even on the busy, chaotic day. Like we get to be a pastor, we get to be a scientist, we get to be an attorney for our patients. Like, and our work matters. Like we get to see lives saved. And even though it's extraordinarily difficult and takes something from us, we also get to hold the hands of the dying and give the bad news and try to do that in the most respectful and humane way. So I think it matters and it feels important and sacred almost. So for me, like I still keep showing up. And I think if I quit feeling that, like that's when I need to quit showing up.
Yeah, it's there's give and take to it. It's interesting that the ending with Dr. Robbie, I read somebody criticizing the way he swaddled the baby. Okay, well, he's unmarried, doesn't have kids. Like, how does he know how to swallow a baby? I didn't learn how to swallow a baby in my training. Did anybody? I don't think so. But I do remember I didn't get married until later, and I had my kids much later than that. So I did have to handle kids though. And when I would go to my friends who had young children, they're like, "God, you're really good with kids." I'm like, "Really? I don't mind hanging them up by their feet, flipping them around and stuff. It's fine. You know, I'm comfortable. You can't really pull their arms and legs off. They stick. It's good." But then when I had kids, I hoped that helped me. Like I was comfortable around children. And then I did learn how to swaddle babies because I had some. And I think I did a better job of that in the ER, right? It is a give and take situation for us. And you have to give both parts of your life, right? You have to have balance. You have to have some break between the two, but it's not completely perfect ever. But it should be getting better. I mean, like you should have more good days than bad days. And that's true of whatever you do, right?
Yeah. It won't surprise you guys. I find I want to answer that question more expansively. What does it take to keep showing up? I want to say, well, what does it take to keep showing up well? You know, what does it take to keep showing up or wanting to show up? What does it take to keep showing up and the patient actually wants to see you rather than wait for another doc to come into the room? Because I'm concerned that docs need to not just show up, but do it in a way that is good for them and good for patients. You know, as we were prepping for this and I was thinking about it, I thought, you know, there's hospital closest to me. If I would be willing to see, I think almost anybody that I saw in terms of providers on the Pitt, if I was a patient and I had to go there because my heart was had stopped, or you know, my shoulder was out of place, or I needed some stitches. But I think I would drive somewhere else if I needed a dose of compassion, not knowing whether I was going to get it from, you know, some of those docs that we saw on this season, or someone who could give a little bit more uninterrupted listening to my issues, or someone who could provide a little extra effort to help me navigate after I'm discharged the healthcare system and its complexities, which I just feel like extra effort is much more likely to happen as an outflow of a heart that's not jaded and totally cynical. So those are the kinds of things I think about. What does it take to keep showing up? One of it, I think, is addressing the challenges from our earliest days in our training. I think this might surprise not just a lot of non-medical people, but I think it probably surprised a lot of people within the hallowed halls of medicine to realize when they did a study in 2014, 12 years ago, they assessed whether students who are about to start medical school, how well do they stack up in terms of how well they're doing? Mental health, quality of life. Well, would you believe that these medical students before day one scored 25 to 35% better than their peers who weren't going into medicine in terms of burnout scores, in terms of depression, in terms of even quality of life, more general scores. But that all changes. The evidence is as soon as we start medical school and start our training. So we got to pay attention to the challenges in medicine, on our overall well-being and our souls from the earliest days. And I know that is getting increasing attention, but that really does need to continue.
I think that's right. And I think that's something that we all, as attendings and as leaders, really need to commit to being there to support not just our colleagues, the people, the teammates that we work with, but our profession and our industry and all the people who are in it. I actually think as jaded and or burnt out or morally injured as a lot of the people were on the show, one thing I liked is we saw that they were there for each other. They allowed each other to get whatever support they needed. And I think we saw it in Dr. Robbie. He kept showing up for his colleagues, for his team. And one of my first medical director when I was out of residency, and he's a good friend of mine now. I remember him sitting me down one of my shifts. It was late at night, and I was arguing with an attending who needed to come into the ER, and I was frustrated. And he actually said, "You know what, Ken? We are the one profession where what we do not only matters, but we advocate for our patients every single day, every single shift." And that's a privilege. And I think what we need to do is carry that advocacy outside of the four walls of the ER. Brian, you talked about workplace violence. It's sad to me that 75% of all workplace violence in this country happens in a hospital or in the healthcare system. And we aren't doing enough as a country. And we need to advocate. We need our legislators to do more to avoid Medicare cuts to clinicians. We need to continue to fight for clinicians, like with the Lorna Breen Act, lots and lots of stuff. I'll share with you guys, actually, I got a text from another friend of mine, an old friend I've known for many, many, many years. And he said, I watched the Pitt all season, and I never realized what you all go through. Thank you for what you do. And I was really moved by that. It meant a lot to me. And what occurred to me, and what occurs to me now listening to all of you talk, is we need all of those people as well who were moved by the show to call up their representatives, their senators, whoever it may be, so that we can all advocate for our frontline workers and for our patients. I think that's something that everybody can do so that our colleagues can keep showing up every shift. All right. Any questions from the audience? I'm just checking right now.
While you look at that, Ken, I'll just say something that resonated as I was listening to you all speak. I think another way that we keep our humanity, and it was something an attending early on told me, you go in as a medical student, you want to get the whole history right. You want to come out with the perfect HPI. You don't want to miss that they had X, Y, and Z done. And so you're like all stressed about that. And this attending said, it's a privilege to take care of humans. Like, these are humans and they have stories and they have families. And he said, I want you to come out with your presentation and tell me something non-medical that you learned about the individual that you're treating. Like, it can be that they have 6 grandkids, or that they've been married for 50 years and that they think the key to a successful marriage is this. He said, I don't care what it is, but learn something non-medical about your patient and make a human connection. And I don't know, I've carried that through my whole career. And I actually have found that it's one of the most enjoyable aspects of the history and physical is learning that little tidbit about them. And, it could be asking them about the tattoo on their arm or about the family member in the room or what they did before they retired, and I've had fascinating stories as a result. And that brings me joy. Like I go home and I'm like, hey, I met a retired 4-star general or someone who worked on the space shuttle. And like, it's just cool. Like, where else do you get to have that kind of encounter? So I think that helps us connect our humanity into those individuals as well. Do we
Yeah.
get any questions?
Well said.
We didn't get any questions. By the way, I agree with you completely about the connection. I think that's so critical to all of us feeling valuable in what we do. So if you all, in closing, had to share one takeaway that you hope everybody walks away with from the show or understanding about our profession of emergency medicine, what would that be? Brian, we'll start with you again.
Yeah, for me, I would just say that the nurses, the NPs, the PAs, the doctors, the techs, like we even saw the pharmacists helping, like we're all people too. And we hurt as well and we care. Like, and the caregivers that are there are genuinely doing their best. And so if as a result of folks watching the show, they understand that a little better, and they give our colleagues who are working shifts right now and later tonight a little more grace because they're like, they do have it kind of hard sometimes, then I think that's a good thing. If the show brought that awareness to society, that's helpful.
Brian, I think I could add to that because I think my takeaway and hope for people listening in medicine or outside of medicine really resonates with that. And that is, I hope people just take away from the show the accurate fact that there's a personal cost to practicing emergency medicine. Physician, doc, nurse, practitioner, whatever it is in the emergency room. There's a cost. The season 2 really brought out that the emergency department can be a soul-crushing, health-crushing place, from people over the years. So I found myself over the years saying to people, when you see your doctor, your doctor needs compassion. And they start nodding their head. And then I say, from you. It needs to be a two-way street. I think the show hopefully did some things where people, the next time they show up, particularly in the acute care, hectic setting, are not just expecting compassion to come towards them. And absolutely, I know the 4 of us all want that and want to be those kinds of physicians. But there's a place for it also being reciprocated. And I also hope maybe for something for the families and friends of people who work in the emergency department. I hope you might feel a taste of the support I felt, a little bit analogous, Ken, to your friend, that after watching one of the episodes mid-season, and my son was home, my youngest, who's in his last year of college, and my wife was with me. And as the credits started rolling at the end of the show, they literally both turned to me and said, thanks for doing that for so many years for me. And that meant a lot.
Yeah, I would say all the high-tech stuff, the systems and the processes and all the things they have wrong, there are real people who are the clinicians there, and they're doing the best they can with what they have. It is true. No matter how bad it gets or whatever, they're there to do what they can. The one thing that I realized as you were talking about it that really hit me about the karaoke was when I was a PGY2, a medical student came back to see me in May, and she had been on my service in the fall, and she just came up to thank me and tell me she was graduating. Well, I was a little rushed because I was still PGY2, and I'm like, what are you doing here? And she goes, no, I really wanted to thank you. I'm like, okay, whatever. Do you need a letter of recommendation? Like, what is it? What does it need? What does it need? And she's like, no, I just want to thank you because you made it clear that we needed to have some life outside of this. when we would get off shift, you'd say, I'm going to the beach, or I'm going to do this, or whatever it is. And what are you going to go do? You need to go do something. And that's what she wanted to thank me for. It sounded like she had come from a family that pressured her to perform and excel and exceed in all those things which we push our kids to do. And she just wanted to know we should be people. And I think we can all do that for each other, whether you're in emergency medicine or not, right? Modern life is not getting simpler.
You know, I think that's so true. That's what I hope everybody watching this season understands, is that in all of medicine, and certainly in emergency medicine, we're people, we're humans. We're going to make mistakes. Bad things happen, and we don't like it. It hurts us when bad things happen. But we're there, and Brian, you said it to start us off on this section. We're there because we care. Because we care about making sure that patients feel better, that they get the treatment that they need. We care about our colleagues. We care about the system. We're showing up not because of a paycheck. We're showing up because this is the best job for us. And I hope everybody walks away understanding that and having hopefully a little bit more appreciation for that nurse or doctor or NP or PA or whomever it is the next time they have to visit an ER.
Yep.
And so I think on that note, we'll thank everybody who tuned in, or those of you who are going to watch the recording later. It was a lot of fun for me this season. I appreciate all of you guys day in and day out. So thank you to everybody, and have a great night.
Thank you.
Thanks, folks.
Thank you.
Okay.